Hello, everyone. I'm Sheldon Baker, Editor-at-Large for Innovision Health Media, and welcome to Healthy Bytes. My guest today is Dr. Mark Tager. He's one of the leading global healthcare communicators. As a physician, he is well-grounded in lifestyle, regenerative and integrative and aesthetic medicine, and guides healthcare practitioners from all disciplines to become more effective clinically and professionally. His most recent book is Integrative Aesthetics, Your Roadmap to Practice Growth. It is the business-based accompaniment to Feed Your Skin Right, your personalized nutrition plan for radiant beauty, and the 10-hour online Inside Skin Beauty professional training program. Dr. Tager is the co-founder of the Vagus Nerve Society, and he is the producer of a soon-to-be-released documentary film entitled Hacking the Vagus Nerve. Dr. Tager, welcome to Healthy Bytes.
My pleasure. Thank you for having me.
So from the title of your latest book, Integrative Aesthetics, I gather that we are seeing a two-way street, functional medicine practitioners moving into aesthetics and aesthetic practitioners moving into wellness. So what is driving that movement?
Yeah, well, first of all, for me, this is very gratifying because I've had about half of my career in integrative functional medicine and half in aesthetics. And they're all underneath the umbrella of cash pay. So we've taken insurance out of the mix. When you do that, you have a unique set of expectations, shifting expectations that people are coming in with today. When they come into the aesthetic world, they wonder, what can I do from inside out to complement the outside-in treatments I'm getting? And when they go to an integrative functional practitioner, that practitioner can really reach out and motivate that individual, inspire them, engage them with some attention paid to skin health and beauty. So we're seeing this both ways. So in many ways, you will get better outcomes in treatments if in fact you're an aesthetic practitioner and you move into functional medicine. You will attract new kinds of patients into your business. You will hopefully have new revenue sources. But I think a lot of this integrative movement is driven by personal interest and personal desire. It's either the practitioner themselves or somebody in their practice who's a champion for this.
For the practitioner who wants to get involved into integrative aesthetics, how do they decide where to start?
Yeah, so this is the same process as bringing any new product or service into your practice. The first thing you have to figure out, and we've got a checklist in the book for this, but the first thing is, who is it for? Who's your persona? Is this an existing patient that we're going to just add things to? And a classic example of that now is the 60% of the 8,000 med spas now offer GLP-1. So this is very often the same patient, or they are also attracting new patients. So is this for the same patient base that you have now, or a new patient base? If it's the same patient base, you can ask your patients, hey, we're thinking about bringing in a hormone replacement HRT program. We're thinking about bringing in a longevity program. What do you think about that? So you can get that. The next thing is you have to look at the resources. What's it going to cost, not just in terms of equipment and staff, but you've also got to market any new service as well. Part of this has to do with letting the world know that you're doing something different and better. Now, one of the things that I really recommend, and I love this exercise, is that I encourage practitioners to go on and Google integrative aesthetics or functional aesthetics near me. See what your competition's doing, what your peers are doing. How are they positioning their products and services? So I think you begin to do that. And then for every new product or service that you bring in, you really need to develop a business plan. You need to understand how much space, how much time, how much person power it's going to take, the cost to advertise and let people know about this. And the nice thing is that so much of the integrative process really is a process. So you're doing things with patients, not necessarily to patients. So I think that And then you've got to be able to figure out if your practice is oriented that way. But there's a checklist in the book, and you can go through that. But those are some of the highlights.
So you've been a powerful advocate for personalized nutrition. What distinguishes this field from the traditional advice you give to your patients?
You know, when I was in medical school about 400 million years ago, I started probably the first nutrition program for medical students in the country with a biochemist named Henry Kamen. This was at Duke University. In those days, we went down to the tomes and we had these big, dusty books from the publications. We'd blow them off, and we really knew a little bit about scurvy and pellagra and a few other things. And we also had the admonition, you want to lose weight, move more, eat less. And what we've seen in the last 5, 6 years has been an explosion in our understanding of how people are different. What's unique about you, the N of one? What's unique about your metabolism, your skin, your digestive system? So we now have assessments that we can bring to bear, and most of them are pretty easy to do to fit into your practice. We have genomic testing. Now we can test genomics for skin to look at the nutrients, why some people need many times more nutrients than other people, based upon the genes that control the absorption, metabolism, and transport of nutrients. We can look at physiological processes. We can look at glycation. We can look at the breakdown of collagen in the body by looking at the genes that affect the MMPs. So we have that body. We can look and see what kind of diets would be best for you, not the person next to you, but based upon what your genes say. Then we also have more sophisticated biomarkers. We can get food allergy testing done, IgG testing. We can assess for red blood cells, zinc and magnesium. We can do omega-6, omega-3 ratios. So we have that body of information. And then when it comes to the gut, there's all sorts of information that will tell us really two things about leaky gut, the increased intestinal permeability, that's a real issue. And the other one is the health of the microbiome, the 100 trillion bacteria that are inhabiting your gut and their composition, the diversity, what they're making. This is the postbiotics, the extent to which they're making things like butyrate that heal the gut, propionate or acetate that goes to the skin. So we have a lot more information, and this can let people fine-tune their programs, but it's also, I found, a great motivator, a great entry point. When you ask a patient, would you like to know what your genes say about your diet and what you should eat based upon those genes, what supplements you should take based upon those genes? So I think all of this is an exciting time.
So there's a lot that we can do to correct a negative situation. I know that you are involved in training practitioners to be more powerful communicators. In your experience, what are some of the tips and hints that can help clinicians attract and retain their patients?
Yeah, that's been one of my passions for about 40 years. I've been training practitioners, trained thousands of them to become more powerful in person, on camera, and online. And it revolves around the concept of presence. You know, what is it? It's attending to someone else, but in the healthcare setting, it's also having an intention. Now, it differs from mindfulness because you have an intention. Now, your intention ideally should be as follows: to light up new possibilities in the minds and hearts of those who are listening to you or with you, or they are your patients. So you do that with a series of skills that you learn that are teachable skills. I mean, many of us going through our medical training just didn't get those skills. You learn that also by coming from a place of passion and excitement. And you can learn these skills over a period of time. Now, one thing about presence, it's sort of like fine red wine. It's at its strongest when you're one-on-one, right within that several feet of a patient. When you're actually, you know, I can go California on you, but feel the vibes. But you sense You have a very close proximity to them, and your presence is at its strongest. Now, when you get up in front of a lecture hall, a group of 100 or 200 or 5,000 people, your presence is very much diluted unless you've learned the skills and techniques to engage, to motivate, to captivate, to keep and hold attention. So there's a set of presentation skills that people can master. And we're seeing a lot of people who are very aspirational right now. We've got everybody doing Instagram reels, and they want to be on the podium. But you really do need to master a set of skills. And then to the camera, there are skills that you need to master as well. They're very different from the big stage, and those are different from one-on-one with a patient.
Earlier I mentioned the vagus nerve, and you founded the nonprofit Vagus Nerve Society with Dr. Peter Staats a few years ago. That was when that came to being. How does vagus nerve stimulation fit into the toolkit of integrative practitioners?
It is central. The more now, first of all, the Vagus Nerve Society is a nonprofit, vnsociety.org. I'd encourage people to join it. We have a certification course. We have about 4,500 members in 72 countries. So it is the primary nervous system driver of rest, relax, restore. So as physicians, we all see patients who come in there wired and tired. And excess sympathetic discharge is either causing disease or driving disease and making it worse. So the body wasn't made to be wired and tired 24/7. It was made to occasionally be wired, and when you needed to run away from a saber-toothed tiger. But you should be in the rest, restore, relax, recover, digest phase for most of the time. And so what we find as clinicians, we have a job teaching people to get into that space. Now, it can be as simple as breathing techniques. It can be things that are a little bit more out there, like cold plunges. But increasingly, there are devices that can be used primarily at the neck, where the superhighway is right there, where all of the vagus fibers are, some at the ear, that can be used in short periods of time to essentially get vagal tone, vagal stimulation. Now, that's important for digestion. It's important for calmness. By the way, the bacteria in your gut that produce all those neurotransmitters don't cross the blood-brain barrier. They work via the vagus nerve. And there's something called the inflammatory reflex. So the vagus nerve is responsible for detecting inflammation and sending signals back down to downregulate the mast cells. So it's really, it's amazing. And then there are, of course, implantable devices as well. So you've got a number of choices there. You've got lifestyle, you've got non-invasive, and you have invasive devices. And it's an exciting field. We're learning more and more about it. In fact, that's how some of the anti-inflammatories like curcumin and fish oil and ginger work via vagus nerve stimulation. So I've been honored to work with Peter Staats, who's probably one of the most celebrated, most knowledgeable pain doctors in the world. And we've been able to create these courses and these educational opportunities for our peers.
Very good. Dr. Tager, we've got just about a minute, but today it seems that everyone is touting a magical treatment for longevity, a supplement, a device, an injection. Where do you come down on all of that?
Yeah. I come down on heavily on lifestyle, heavily on diet, heavily on stress and how we treat others and our thoughts. All of that is important. I'm not saying that the science isn't important, because I'm deeply into personalized nutrition. I think this is really critical. I think there are biomarkers and tests that you want to know about. But if you think of longevity today, it's sort of like the new wellness. It's it's like a big umbrella. And there's red light and hyperbaric oxygen and this supplement that's doing this and telomere enhancement. And there's a piece of it that is early detection. Okay, so there are full body MRIs and all these biomarkers that are essentially the new form of prevention, early detection, That's a great thing. But in this is a whole host of other factors. There is science behind all of them. Whether or not they are the most powerful tools, I don't think so. I think the real powerful tools are in how we lead our lives. And these are supplements and augments and things that can help us fine tune. Except, of course, when you catch a disease early, then you can make a major intervention. So that's the longevity. In my book, I talk about 5 wellness services you can include: personalized nutrition, hormones, gut health, metabolism and muscles. We need to remember about muscles, and longevity.
What's the best way for our viewers to reach you?
Yeah. So they can hit me up on LinkedIn if they're professionals. They can also follow me on Instagram, which is DRM Tager, DRMTAGER, and grab any of my books on Amazon.
Dr. Tager, thank you for being here today on Healthy Bites.
First of all, I love the whole idea of Bytes, because it goes right back to personalized nutrition.
Very good. Thanks to all of you, too, for watching Healthy Bites.
Take care.